Welcome to News West 9's West Texas View with Johnny Lou Avery.
Am I sounding so bad that you can't understand? Welcome to the West Texas View. I'm Johnny Lou Avery, and it's such a pleasure to welcome back Dr. Melinda Marist, who is a teaching fellow at the university. At the Texas Tech University Health Science Center, but she's also in private practice, and you'll see her number and the address of her office rolling across the screen in just a minute. And also her email address. So if you want to email either me or her with any questions that you've got, then some general information can be given. But last Sunday, we talked pretty much about the menopausal period, which could be as early as 35 or as late as 56 or 60 for a woman, and all of the things that are happening in a woman's body that's causing some real upheaval, not only with the woman, but also with the whole family. But today I asked her to switch gears and talk a little bit about the behavioral changes that happen in the urology of a woman. And I noticed that on that chart that she had last week, the incontinence and several other things having to do with the bladder was listed on that, and so I was really interested, and this is a subspecialty of yours, of gynecology.
Yeah, well, urogynecology now is becoming a subspecialty of gynecology, and there are actually fellowships in urogynecology. And a urogynecologist is a board-certified obstetrician and gynecologist who has done additional training that specifically focuses on the bladder, fallen, prolapse of the pelvic organs, and also even some colon problems in the women. So anything that involves the pelvis, any neurological deficits, any muscle weakness, any fallen bladder or fallen uterus, any urinary leakage, those problems are addressed by the urogynecologist now. And they do the assessment, they make the recommendations for treatment, and if surgery is indicated, then they perform the surgery as well.
Now, I understand that that's not a real complicated thing. So the what do you don't call it pinning up of the bladder?
The bladder suspensions?
Bladder suspension.
Well, it all depends on what the particular defect is, and it can be a very complicated, very intricate procedure depending on the actual defect that's there and needs to be repaired.
Does that have anything to do with weight?
Yes, it does. Probably obesity is a major contributing factor to bladder loss or urinary incontinence and even pelvic prolapse. So I like to educate women, about these issues. Even when women come in just for their annual exam, I'll ask them if they're having any bladder problems, because women are reluctant to discuss it, and it's a very prevalent problem. In 2010, there's probably 28 million women that are affected with some sort of urogynecologic disorder, either urgency symptoms where they feel like they're having to urinate frequently, or stress incontinence where if they cough, sneeze, do any sort of physical activity, they're leaking urine, or they can feel like something's falling out. Their uterus is falling out, or they're feeling a bulge in the vaginal area. They can notice some changes there. Also, even constipation issues can be related to some of the disorders as well. And probably 50% of women that have symptoms don't ever seek treatment for it. Some women just feel like it's a part of the aging process and it's something that they have to live with.
And they don't.
And they go start buying Depends and they don't say anything about it, and they don't realize that there really could be some treatment options for them. And also, the longer the problem exists, the harder it is to correct. And so you really want to have these issues addressed as soon as possible. Now, the mean age for the most occurrence of these problems is age 61. So it does start to progress as women get older and become menopausal. And actually some of the changes can occur because of the changes that are occurring with menopause. because the hormones that are being produced can actually maintain the strength and integrity of some of those pelvic structures. So, you know, as tissues thin out over time with lack of hormone, it affects the structure, it affects the support, it affects the function of the bladder, and so these symptoms become more prevalent over time. Younger women can also have problems, and most of the time that's related to childbirth, you know, because just delivering a baby vaginally can weaken your pelvic support system in the pelvis. And so stress urinary incontinence, where they're leaking with coughing and sneezing, is actually more prevalent in the younger population, where urgency symptoms, to where you just get this strong urge to run to the bathroom and you feel like you may not be able to make it in time, those symptoms are a little bit more prevalent as you get older. There's also a condition called the overactive bladder syndrome, where they're having frequency, urgency. If you're going to the bathroom during the day 8 times or more, that's considered frequency. So, you know, those issues need to be addressed. And then in addition to that is the nocturia, where you're having to get up in the middle of the night and go to the bathroom as well. So if you have to get up at least 2 times or more during the night, that's considered nocturia. So there's a whole host of different medical conditions and issues that have to be assessed and addressed to help alleviate these symptoms and problems.
But you know, the other side of that coin is, what about people who don't seem to ever need to go to the bathroom? They just wait and wait and wait, and maybe, are they stretching their bladder? Is that what causes
Well, they are stretching your bladder, and when you work in the medical field, you can brag you have a 12-hour bladder, which really isn't healthy. But, you know, and teachers have that problem, you know, because sometimes you're in a profession where you're not
just can't drop something.
You're not allowed bathroom breaks. I think, you know, I feel sorry for the teachers. They you know, they have to wait until recess or lunch before they can go. And so, you know, over time you can kind of train your bladder to go longer, but it's not necessarily healthy for your bladder.
It's not good for it.
Yes, yes.
We're going to have to take a break right now. We'll be back in just a minute and continue this conversation. But again, note the email addresses that are rolling across your screen, and also the phone number, because you may want to make an appointment with Dr. Morris, or you may want to email a question for her. We'll see you in just a minute.
Stay tuned. West Texas View will be right back.